Hello there, I'm Hannah Wise. This is CNN Money Switzerland. Welcome along. In this episode, how Swiss tech is hoping to be part of the solution in the continued spread of coronavirus. Basel-based NextStrain says we're past the point of containment, but we can mitigate spread. Anna Maria Montero is here to take up the story. Over to you, Anna Maria.
That's right, Hannah. Take a look at this map. It's just a broader picture of the data on NextStrain, and you can see how different strains of the virus have traveled. So, for example, we can take Italy traveling all the way down to Brazil. Now, this could even be seen in the same city. What's important about this? Well, with cases rapidly multiplying, it's becoming more and more difficult to track the virus simply by asking where someone has traveled to and who they have interacted with. It's much easier just to look at the sequence itself. Now, by linking up these cases, scientists can help governments stay one step ahead and decide what action to take next or what containment measures are needed. Now, I spoke to Emma Hodcroft earlier. She's one of the people working on the project, and I asked her, how can we use this information even more?
What this can help us with is mitigation. So what we can do is find out where the virus is right now and how it's spreading. So for example, is it spreading mostly through contacts within that community, or are there new cases still being imported? And if so, from which other countries? And this can really help to give us a handle of how fast the epidemic is growing, or where certain areas might need more containment measures or mitigation measures, or where hospitals should perhaps be being prepared for taking more cases.
Talk to me about the role of social media in all of this, because platforms like Twitter are really helping in data sharing, no?
Yes, so this outbreak has really emphasized how important public and social media platforms and other public forums can be for scientists to do analyses. We have really seen unprecedented things here where data and information has become available at lightning speed. And we've been able to share that on the internet, but then also collaborate. So scientists have been putting up their own analyses, and then we can get critiques and criticisms, suggestions, and people can incorporate it into their own work, all essentially in real time, which has never been possible before. So the role of public media and open sharing has really come to the foreground in this outbreak.
But it hasn't been without its challenges, as I understand. There's also a lot of debunking that's coming along with your job these days.
Yes, so particularly with the advent of what we call preprint servers, where you can put a paper online, but it hasn't been evaluated by anyone else in the scientific community, we've seen some unfortunate examples of quite misleading science, and even in some cases, some bad science. So the snake flu paper was one of the first, and one of the perhaps worst ones was this idea that HIV is somehow in the virus. This was completely debunked and the paper was retracted, but the idea is still persisting online. So something that we're having to be very aware of as scientists is to try and make sure that the information we make available is good science, that it's well supported, and that we make sure that it can't be misinterpreted and used to generate more kind of fake information and misinformation. But it also has been a positive because we're able to reach out with that good science and help try and translate that into forms that are more accessible and more digestible for the general public, to hopefully help people feel like they're well informed about this outbreak and that they know what they can do to try and help stop transmission.
Well, let's break this down further. Joining me in the studio is Anna Maria Montero, and we're also joined by Olivia Chang as well. I'll come to you in just a moment. But Anna Maria, where is this company, NextStrain, getting their information from?
Well, they work with an initiative, a Munich-based initiative, nonprofit called GIZAID. And basically, they have a unique sharing mechanism where they promote the sharing of epidemiological data associated with human viruses. So now NextStrain is just kind of tapping into their database in order to track the coronavirus, as we saw.
And what does their story really tell us about how tech is helping deal with coronavirus?
Well, according to Hodcroft, what we're seeing is unprecedented. So, from data sharing through the scientific community also coming together through these open source platforms, the low cost and velocity at which you can do the sequencing at this point, and social media, all these things coming together is something that we have never seen, and it was unimaginable just a few years ago.
All right, well, that's just one way tech is being used. Olivia, you've been looking at how people are getting their information on coronavirus, and it turns out there's been a spike in telemedicine. What have you found?
Hannah, let me just give you the big numbers so far. The Swiss government has set up a hotline on its website so anyone can call up about coronavirus. Just this week, they've told us they have clocked up about 20,000 calls since they started this hotline back in January 30th. And they've also added about 20 extra people to staff this hotline just this week. So we can really see the numbers ticking up. If you're with health insurers like Helsana or Suica, they're also reporting figures of spikes of up to 50% in terms of requests and calls. So we can really see these figures ticking up.
And this is, in fact, a good thing.
Well, yes, it is good because you don't want to be stuck in a crowded hospital or waiting room with others who potentially have coronavirus if you are healthy. And we've spoken to experts, and we also don't want to infect those on the front line to protect caregivers, as taking the strain off those in the health industry. But if you belong to certain brackets, like if you're pregnant, part of the elderly, or those with chronic diseases, then you should be getting an examination.
All right, well, there are quite a few burning questions on coronavirus out there. For me, I still want more information about what specifically these underlying conditions are and whether I should be worried about any of them. Anna Maria, do you have any kind of burning question?
Well, I mean, aside from the fact that, how susceptible are children to this, it's also this question of if it's similar to the flu, how do I know that what I have is not, in fact, the flu?
And not coronavirus.
Exactly.
OK, Olivia, any of those in the top 5 questions that people are asking?
I wish I could be your go-to health expert, but I'm not. But if you take a look right now, we've got the top 5 questions or top questions that people are asking when they're calling this coronavirus hotline from the Swiss government. And of course, some of them are just really basic. I mean, you both of you went a little bit beyond, but some of the questions are, what is the coronavirus? What are the symptoms? Others are, how are suspected cases being taken care of? How can people prevent themselves? And some people even asked, is it even possible to be infected in Switzerland? And as we know from the latest figures today from the press conference, yes, at least 54 people have been infected so far. So yes, these are some burning questions that people want the answers to.
All right, Olivia Chang and Anna Maria Montero, thank you both very much indeed. Well, all the latest coronavirus coverage is available on our website. You can check our special updates page, which is at cnnmoney.ch. And of course, as Olivia just mentioned, the Swiss government says there are at least 54 confirmed cases here in the country. Meanwhile, in Italy, a decision is being taken as to whether to close all schools and colleges for 2 weeks from Thursday until mid-March. And this week, we've been looking at why you should keep traveling during the coronavirus outbreak and what central banks are doing to prevent a serious economic slowdown. And just for you in this episode, with hand sanitizer either overpriced or out of stock, how to make your own.
With the worldwide spread of coronavirus, the World Health Organization advises people to wash their hands properly in order to reduce the risk of getting the virus.
But when there's no way to do that, many turn to hand sanitizers. The demand for these has increased over 10 times in the past few months due to the coronavirus threat. But in many places, hand sanitizers are sold out, like here. And if you find a place that is willing to sell it to you, then you have to be willing to pay a hefty price. But actually, you can just make your own hand sanitizer, and I'm going to show you how. And for that, you need to find the right ingredients.
So I will start with alcohol. According to the recipe by the WHO, they're doing it for a 10-liter preparation. Of course, I'm not gonna do that much hand sanitizer. That's why I broke it down. I got 150 milliliter of alcohol. That's what I'm going to use. And according to that, you will see how much I use of the rest. Alcohol, 150 milliliter. So for 150 milliliter of alcohol, I need about 7.5 milligram of hydrogen peroxide. This is kind of hard to measure. Okay, I think I need my cameraman to open this bottle for me. Thank you. 7.5 milliliter. I got a measuring cup here. It's not very exact. I have 1 deciliter, but by the eye, it's about 2. Okay. Now you have the choice, do you want glycerin or do you want aloe vera? I think I'm just gonna mix both of them. If you take purely glycerin, you would need about 2.6 milliliter, that's not a lot. And then if you feel like your solution is too fluid, you can always add a bit more of aloe vera gel to make it a bit more jelly. What? I feel like I'm doing a cooking show. I'm going to add some lavender drops. Smells much better now. And my self-made hand sanitizer is done. Now what I need are some bottles, like you can get empty shampoo bottles in drugstores. And I'm just gonna fill in. Here we go, my own hand sanitizer, and that was super easy. And you have to make sure you rub your hands well between your fingers, otherwise it doesn't help.
All right, well, if you've been affected by coronavirus, you can get in touch with us on all our usual ways, social media, Twitter, Facebook, LinkedIn, and Instagram. Whatever the comment is, always great to hear from you. And don't forget, everything is also available on our website, cnnmoney.ch. We'll see you tomorrow. Bye-bye.